Yeah.
early.
So, cervical cancer screening should be done from the age of 21 years onwards, whether a woman is sexually active or not. And after that, it should be done every 3 yearly. In case we are combining an HPV screening along with that, 5 years. Yeah. And it's a test which is very easy to do, hardly takes 2 minutes to do. It's not painful, it's not expensive, at least in India. And it's a very easy thing to do. Once again, India has a very high cervical cancer rates. So once again, here women who are having a single partner, they also get this. So even if the risk factors could be multiple sexual partners and STDs, but I've seen housewives who've been into a mutually faithful relationship also getting a cervical cancer. So probably because in India we are not proactive in our screenings, women come to us very late when the cancer has already into stage 2 or stage 3. So a regular pap smear can actually pick up a cancer 7-8 years before the actual cancer develops. So cervical cancer has a very long history. So something known as CIN1, CIN2. So these are all precancerous stages. By doing a pap smear, we can pick up women in these precancerous stages, whereby just a simple local treatment, excision or a cryotherapy or an electrotherapy, can cure a patient
Completely.
completely. Once again, you need to get the test done. And today we have cervical cancer vaccinations, HPV vaccinations. So if you can afford the vaccine, please take the vaccine.
It's around age 12 or 13, right? When should we
So
get
the
it?
vaccine in India, it is 9 years onwards.
9 years.
Now, hopefully, it should come. It should now become part of the national immunization program. Since it's a little costly vaccine, the government is working on producing an indigenous brand for the HPV vaccine. Once that happens, hopefully, it should come into the national immunization program. But 9 years onwards, it is recommended. The best time to take this is 9 to 26 years. After 26 to 45 years, it is known as rescue vaccination. And beyond 45 years, it's useless. Yeah. Because the idea is by that time, you probably would have been exposed to HPV on your own.
This happens in my neighborhood a lot.